Can COVID-19 be blocked by a hormone? We already have a good sense that the hormone vitamin D can help build your resistance to COVID-19. But there's another hormone, melatonin, that appears to play an important role in the prevention and treatment of COVID-19. This is important in helping you stay healthy while waiting for a safe and effective vaccine. Nation being addicted.
Dr. Terry Shintani, Director of Preventive Medicine at Sinai.
Hi, I'm Dr. Shintani. Please consider subscribing to this channel and click the bell for notifications to keep up to date on COVID-19 and how to stay healthy for up to 120 years. There's new information about COVID-19 that suggests that melatonin may reduce the mortality of COVID patients and may even help reduce your chances of getting infected with COVID-19. There was an early report that melatonin was associated with improved survival of intubated patients. More recently, there's evidence that melatonin can even reduce your risk of getting infected by COVID-19. There's a data analysis at the Cleveland Clinic of 26,779 individuals that suggests that melatonin usage is associated with a 28% reduction in likelihood of being infected by COVID-19. In addition, among African Americans, there is a 52% reduction in likelihood of testing positive for COVID-19 among those who use melatonin. Melatonin is a supplement most commonly used to help with sleep, but it is also well known to support the immune system. In fact, high levels of melatonin are associated with protection from viral and bacterial infections and appears to reduce the risk of certain cancers. Melatonin is a natural hormone made primarily by the pineal gland in the brain that helps to regulate our sleep and wake cycle. At night, when it's dark, the pineal gland produces the hormone melatonin, which helps us to sleep. When the pineal gland senses light, it shuts off melatonin production so you won't remain sleepy. An interesting connection between melatonin and the resistance to COVID-19 is the fact that bats, which is the animal that is believed to be one of the sources of this virus, are not affected by the virus. Some research believe that this is because bats have very high levels of melatonin as a result of being nocturnal animals and being in the dark most of the time. It is also of interest that young people tend to have higher levels of melatonin than older people and are at a lower risk of having severe symptoms from COVID-19. This may be one of the major factors in explaining why older people have a much higher mortality rate from COVID-19 than younger people. For optimal melatonin levels, people should get a good night's sleep every night of 7 to 8.5 hours. It is also important to keep the bedroom dark or use a sleep mask to limit light exposure. And when using the bathroom at night, use a night light instead of turning bright lights on. Because research findings are fairly strong in favor of the use of melatonin in COVID-19 cases, and because melatonin is known to be quite safe, melatonin is being recommended as prophylaxis to COVID-19 by some experts. They recommend up to 3 milligrams per evening to be taken an hour before bedtime because it may cause drowsiness and is commonly used to induce sleep. Higher doses can generally be used safely, but you should consult your physician before doing so. Of course, because of this, do not use before driving a car or doing anything that requires alertness for around 5 hours after taking melatonin. Other possible side effects include transient headache, mood changes, and interaction with prescription medications. So if you're on a lot of medication, consult your physician first before using melatonin. So while waiting for a safe and effective vaccine, it's important to give yourself the best chance of preventing and surviving COVID-19. Melatonin may be an important factor not only for sleep, but for boosting your immune system to give yourself the best chance at surviving this pandemic. Please consider subscribing to this channel and click the bell for notifications to keep up to date on COVID-19 and how to stay healthy for up to 120 years. This is Dr. Shintani for your health.